Hi, I'm Bill Callahan of Connect Your Community. This is another short Zoom conversation with one of the folks who's been working for a long time in Cleveland to close the digital divide and bring us some more digital equity in our city. Adam Perzynski of Case Western Reserve University and MetroHealth Medical Center at the Center for Healthcare Research and Policy at those two institutions, where Adam is a associate professor tenured, I see, in your vita, and also is director of a patient-centered media lab, a project which I believe he put together, and the strategy, chief science and strategy officer for Global Health Metrics, which is a business enterprise that he and some partners have put together. So a busy guy and very much involved in digital equity in the field of health. He is also a board member of Connect Your Community, and in that role has worked with CYC and with the Ashbury Center and other folks for years around projects to allow more patients to use patient portals at MetroHealth and other institutions. Since the COVID epidemic, needless to say, Adam and his colleagues at MetroHealth have had other things to think about. And so what we really want to talk about today is the way in which his commitment and his involvement in digital equity work has changed, and how the healthcare profession, healthcare institutions have changed their treatment and view and response to digital equity concerns as a consequence of what's been going on for the last 7 months. So Adam, thanks very much for joining us. And why don't you just start with that question I just raised.
So in terms of how things have changed, so I think to say that I probably have to start a little bit at the beginning of sort of where passion and interest around digital inclusion comes from, both at MetroHealth and in my own scientific work. And I think this really comes from at least a decade or so ago, in part getting to know Bill, but also coming to an increasing realization that as components of the healthcare system begin to rely more and more on patient-facing health information technologies, then lack of access becomes all the more important for the health outcomes of patients. So in a world where you did not gain any benefit from having a electronic patient portal or a health app on your phone, then you couldn't be at a disadvantage. But now that we are in a world where you can gain benefit from those things, that when you don't have access, then you are left behind on the wrong side of the digital divide, so to speak. So we've known about this for a while. One of the things that I thought I would talk a little bit about is that we at MetroHealth have included screening our patients for internet access in their home and having a computer and having digital skills as part of a broader social needs screening. We started that social needs screening really the beginning of this year more aggressively. And at this point, I think we've reached almost 25,000 of our patients have responded to questions about their social needs. And by social needs, I'm talking about things like social isolation, food insecurity, daily stress levels, difficulty with transportation, not having enough money, being worried about your housing, and facing violence in your home, and facing challenges with internet connectivity. So what we know from that first group of folks that who we've surveyed, most of the past 10 months have been the 7 months of the pandemic. We know that overall, the number one social need people describe as being socially isolated from other people. That's closely followed by food insecurity. Overall, the internet connectivity comes in at number 4, with roughly, depending on age group, between 10 and 35% of individuals in our healthcare system saying that they have trouble with internet connectivity. But if we look a little more closely and we look at our older patients, who are most of our patients, because who uses healthcare, that tends to be folks who are older. Actually, not having internet connectivity is the #1 social need among persons 65 and over who are cared for by MetroHealth. So if we imagine so this is the biggest social need, and all of the ways that we connect to care now include telehealth and Zoom meetings, refilling prescriptions online, wanting to keep people out of care settings to protect them from the chance of getting infected, especially in the early phases of the pandemic. All sorts of rules and policies around visitation and long-term care. And so being able to use digital devices to connect with others is so important now, and thinking that a huge portion of our neighbors and our patients are sort of cleaved off via lack of internet connectivity is actually totally heartbreaking for me. The upside of that is that I think it's also built some energy around efforts that were already brewing to address gaps in communities and among subpopulations that don't have internet right now.
So then let me ask a follow-up question to that last point you made. Obviously, you've, along with a lot of other people here in Cleveland, have been thinking about various measures that need to be taken in the community, or various problems that need to be solved in order to deal with the fact that a huge part of our low-income population is stuck on the wrong side of the digital divide. Do you have any new ideas or different ideas about priorities for that work, or ways to get at it that hadn't occurred to you until we went through this experience of everybody being heavily dependent on it, including the hospitals?
Yeah, so I think there are some really interesting things that are happening. One of the main ones is the thing that has been front and center in the community has been sort of on the opposite group that I talked about, because we think about school kids who need access to do their schoolwork every day. And so there's been a lot of energy in connecting households with children specifically. Many of those households tend to not be the seniors that I'm talking about, though. And, so there have been a couple of shifts that our care system has made, one of which I wrote about in a recent paper, which was that due to the simple lack of connectivity, we've adapted our telehealth visits to use the telephone, because we need to be able to care for folks no matter what. That's not the best solution, but it is a solution. So even on our COVID hotline, most of our visits at MetroHealth on the COVID hotline are telehealth visits and not televideo visits. However, I think one of the most exciting things are partnerships between places like MetroHealth and internet service providers, community training organizations that are really working hard on this problem. Here, the work of Digital C and Empower CLE are notable in this regard. And I think our own care system has supported this by putting an antenna on top of our building that's providing internet access, low-cost internet access to residents across the street. So, I think that's a huge step. Not every place is going to do that. And then actively seeking to provide subsidized, low-cost, or free internet for households in those neighborhoods nearby the care system, to sort of bring as many households online as we can. And then a specific focus on one or two residential communities that are communities of older adults specifically. So one specific housing structure on the near west side of Cleveland, where again, as part of this partnership with Digital C, now seniors have access to high-speed internet and digital skills training right where they live. So I think those are really special and exciting developments that are popping up all over Cleveland at this point. And I think that momentum is something we really want to harness, because the need is greater than ever. And so 100 households here and there is good, but it doesn't quite get us to the 50,000 or so households citywide that we really are going to need to reach to make sure that everybody's connected.
Well, thanks, Adam. That was really a interesting account of a broad view of what's going on. And happy Digital Inclusion Week 2020.
Thanks, Bill. Yes, and hoping for a Digital Inclusion Week 2021 where all these numbers look better.
Amen. Take care.
You too.